Hello, today Stephanie and I, Giovanna, will be presenting our clinical case for MI, otherwise known as myocardial infarction or heart attack. So our patient here is Mr. Lopez. He is a 45-year-old male of Hispanic descent, and he presents with a blood pressure of 128/78, a respiration rate of 16, and a pulse of 88 beats per minute. On his health history form, he reports having a heart attack 7 months ago, and the current medications he takes are Coumadin 3 mg once a day, baby aspirin 81 mg once a day, and atenolol 15 mg once a day. And because he has controlled elevated blood pressure and is under the care of a cardiologist for his past history of heart attack, he is classified as ASA 3. Question number 1. We must obtain Mr. Lopez's INR result because he takes 81 mg a day of baby aspirin. Is it A, both the statement and reason are true, B, the statement is false, the reason is true, C, the statement is true, the reason is false, or D, both the statement and reason are false? The answer is C, the statement is true, the reason is false. We do have to obtain Mr. Lopez's INR result because he takes Coumadin, otherwise known as warfarin, not aspirin. Coumadin is an anticoagulant which increases the risk of bleeding. Aspirin taken alone has no effects on bleeding, but when taken with warfarin, bleeding will increase. Comprehensive exam findings. Mr. Lopez presents with an ENI within normal limits, a number 30 MO diagnosed by the dentist, light calculus generalized to anterior teeth, medium calculus localized to posterior teeth, and he also complains of dry mouth. Contraindications and indications. Mr. Lopez's treatment plan will be taken care of in 4 appointments. Appointment number 1 and 2 will be his adult prophylaxis. Appointment number 3 will be his mesial-occlusal composite filling on tooth number 30, and in 4 to 6 months we will see him again for his recare appointment. For patient management, we must obtain a medical clearance from the cardiologist and an INR lab result that is less than 3 months old. We must also limit the use of epinephrine and document any side effects that he experiences from the medications listed. We must also be aware of increased bleeding and recommend saliva replacement products for his xerostomia. We must also try not to rapidly move the chair because it puts our patient at risk for hypotension.
Question number 2. We must obtain a medical clearance if the MI occurred less than 3 months ago. We do not need to obtain a medical clearance if the MI occurred more than 3 months ago. A, both statements are true. B, the first statement is true, the second statement is false. C, the first statement is false, the second statement is true. D, both statements are false. The answer is B. The first statement is true, the second statement is false. Medical clearance is always needed for MI patients. Discussions with your patient. The RDH. What we do not only affects the mouth, but the body systemically. We have to be cautious due to your health history. The DDS. Mr. Lopez, you need some dental work completed to restore your oral health. Because you had a heart attack 7 months ago, before we do anything, we need a clearance from your cardiologist and an INR lab result performed within the last 3 months. The treatment planner. We will fax a medical clearance for you with your approval to your cardiologist. Once we hear back and obtain your INR lab results, we can get you scheduled. Patient care and follow-up. 1. After receiving the cardiologist clearance and less than 3-month INR lab results, which reads under 3.5, you can now schedule the patient for their dental care. 2. Once patient-provider relationship is established, recommend healthier diet habits, incorporate exercise, stress management, and lifestyle changes to help prevent recurrent cardio implications. Bonus question! If Mr. Lopez had a stent put in, would he still need to premedicate with antibiotics? Tricky, but no. Premedication is not necessary for a stent, but is necessary for a shunt. Giovanna and I, Stephanie, want to thank you, and listed below are our references.